I'm a commissioner on the Commission on the Social Determinants of Health, and that's the question we're addressing on the Commission. How can we make the world healthier, and how can we make it more equitable so that health's distributed well? And obviously for Australia, the big issue there is about Indigenous health and the 17-year gap in life expectancy. So this was a great opportunity to try and ask the question, not just how can people live longer, but how can they live flourishing lives when they're alive. So that's the crucial question, and that's exactly what the Commission's looking at as well. Often when people talk about health, the first thing they ironically talk about is illness. You know, they think about hospitals and health services and how there's not enough of those. So I think the real challenge is getting that motivation that everybody has to have a good life for their kids, to have a good life for themselves, to live in a clean environment, to have a good house, a good job. It's not rocket science. That's what everybody wants. But it's also bringing the realisation that it's not just about economic growth. And that's clearly what we've been talking about at this conference, that it's about a whole raft of things. It's about governments being prepared to intervene and take action to promote health, being able to use taxation, providing welfare in a way that it supports people, doesn't make them dependent, but on the other hand doesn't leave them on their own, and making sure that as a society we look after everybody. We look after the people who don't have the things going for them, who can't cope with life circumstances, and ensure that everyone really has a chance for a decent and, as the Commission is saying, a flourishing life. We don't have much health research. We have lots of medical research, so we have a National Health and Medical Research Council, but most of the focus is on the M in its name and not on the H, on the health. And I'd love to see us have a programme of research to look at the social determinants of health. So we really look at the ways in which housing affects our health, or racism affects the health, particularly of Indigenous people, or the ways in which the way we organise work affects our health. We've just heard from Professor Sue Richardson about how in the last few years we've really organised our workplaces so they make it really hard for people to be good parents. So we've got to look at ways and find out what are the best arrangements so that parents can support their children. What are the best arrangements for our society so that old people aren't lonely and so that old people can live fulfilling lives. And you could ask that about any sector of the community. But at the moment what we tend to research is little bits of the body, the liver, the kidney, the lung, and that's important too, but we're putting all our eggs in that basket and we're not putting any in the health basket. One of the really positive things is that the government has made a commitment to closing the gap. That's the first step. The other obviously big step was the apology. I mean, I think that had huge symbolic importance, but it's sort of beyond that because it's about an acknowledgement. And I imagine if you're an Indigenous person, just to have that acknowledged. We have heard all about those sort of psychosocial impacts on health. That's got to make a huge difference. And I think we were all struck on that day of how happy all our Indigenous colleagues look. So that is in itself going to have a good impact on health. The real question now is how that gets followed through, and that we recognise that this is not, it is about getting our health services right, that's very important, but it's also about ensuring that all Indigenous children have great, you know, as we've just heard, that what happens to you in the first 2 years of life has a big impact on your brain, and we have to ensure that all Indigenous children grow up in wonderful environments that encourage them to flourish, then have the opportunity for education, and then can go on to interesting and satisfying jobs and live in good houses. I mean, it really is that simple in a way, and it shouldn't be beyond us. We're rich enough in Australia to achieve that. There's absolutely no reason why we can't. If we really put our minds to it and think creatively and accept that it's about resources and accept that that's the pathway to health, that's the pathway to closing the gap, is closing the gap on those social determinants. And it's pleasing to see that COAG, the Council of Australian Governments, has set numeracy and literacy as one of the goals, because that's got to be one of those stepping stones. And housing has got to be one of those stepping stones. And unfortunately, for some communities, basic issues like water and sanitation have got to be those stepping stones. But it's about constructing a pathway and saying we have to get these things in place. But I guess the real challenge for Indigenous culture is that it's not about an assimilation. I think we've heard very powerfully at this Fulbright Symposium, it's about also appreciating the great strengths of Indigenous culture, the way that Indigenous people did manage to live on the land for 40,000 years without having hardly any impact on it. And that really contrasts with Western industrial societies where we're having such a devastating impact. So it's about a mutual learning on both sides, I think. That's what we have to achieve. If you compare the country Lesotho, that has the lowest life expectancy in the world, of somewhere in the 30s, with Japan, which is in about 86 for Japanese women, we're looking at a 53-year difference. I don't think we're saying that's because Japanese people are particularly good at looking after themselves, but I think we are saying that Japanese society has done something right about the way they look after each other collectively. And I certainly don't need to tell Indigenous people how important that is, this idea of collective well-being. So at the end of the day, yes, it's a choice that people make to have a fag or not have a fag, but that choice is within a context of a historical set of circumstances about a white invasion, about people arriving on the shores of Australia, about taking away land, taking away culture, removing children from their family. And wherever we look in the world, people who live in situations of poverty and social stress do turn to supports for themselves in that situation. And that might be smoking, that might be alcohol, that might be drugs. But I certainly don't think that it's useful policy to blame those people. I think what you do is say, how do we create an environment? And one of the slogans we've had since the 80s is making healthy choices the easy choices. Well, it's very hard to make the easy choice when all the environment's against you. When the environment's for you, it's very easy to make that healthy choice. So I think that's the real challenge for Australia, to work with Indigenous people to make sure that they have the environment to make healthy choices. If you have control in the workplace or in your life, you're healthier. So it makes sense that if Aboriginal people can control their own health services, make decisions about how they're run, what services are provided, what staff are employed, that per se is health promoting, as well as likely to end up with services that are much more appropriate for Aboriginal communities, because that kind of intimate knowledge, those ideas about how the services should be run in a way that is acceptable and effective for Indigenous people is going to be so much higher. So for me, Aboriginal control of perhaps not just health services, but as much of the kind of decision making about Aboriginal issues in Australia should be in Aboriginal hands. And that's a good thing. I think the fact that the ministers announced the Indigenous Health Equity Council with a majority of Indigenous members is absolutely fantastic. I really think that's a very important move.